Hey, what's up guys? It's Ryan with Revolution Performance, coming to you with another video today to demonstrate myofascial cupping. So cupping got really popular after Michael Phelps had those marks on his back at the Olympics many years ago. Ever since then, the internet's kind of ran with that, and it's become a lot more popular. It's also a very effective treatment technique in physical therapy. I find it real helpful on the upper trap muscle as well as a few other locations. So I'm going to demonstrate on the upper trap today. We have our volunteer here. Molly has graciously agreed to allow us to film her today and get some of the tightness out of this right side of her neck. So you can of course do both sides. We're going to show just the right side here for the sake of the video and kind of walk you guys through it. So like any other technique, cupping, there's a lot of different ways you can do it. One of my favorite, and the one I'm going to show here, is moving the cup with a little bit of emollient or lotion. That kind of reduces the marks that you get from the cupping because it's not in a static position. The marks aren't a bad thing. It is part of the science behind why the cups work, but a lot of people are adverse to that. So a lot of times when I'm cupping someone for the first time, I'll go with that. It's also a little bit more comfortable as well and feels pretty good, especially on the upper trap, where, like I mentioned, a lot of people carry their, stress and tightness. So we'll start to put a little bit of emollient on here so the cup glides nicely. And go all the way up to the neck, wherever you're trying to treat. And the cool thing with the cup is a lot of manual therapy techniques. They're all based in compression. So, think massage, foam rollers, instrument assisted work. It's all based in compression. The unique thing about the cup is you get some decompression. You actually get some pulling apart of those tissues. In ultrasound studies, they've found that up to 6 millimeters of space can be created within the body, which is pretty significant when you're talking about something that's not even an invasive procedure. So I think that's really cool. We have the pump here and and I'm going to use this size cup today. I prefer the clear ones just because I can see what the skin's doing as I'm kind of working. Lots of different cups, brands, companies that make cups out there. These are just what I prefer. I have used a couple different sets, but basically, I'm gonna clean my hand off there, and you kind of just come in here. You start with as little pressure as you can here, and basically, since I have that emollient on there, I'm hoping you guys can see this okay. After I have the suction created, you can see, hopefully you can see that I'll bring you guys in a little bit. So you can see you get a little bit of that blood response, so you get some lift of the skin. That's only one pump with that hand pump as well. So you kind of glide on the skin. Oh yeah, nice spot in there. So it's usually around there. And with the cup, especially the first couple times you're gliding it around, you can really kind of feel the restrictions in tissue. So like I said, a lot of different kinds of techniques and ways we can use this. But this is one of my favorite and one I wanted to show you guys today. So thanks guys, and stay tuned for more videos.